These stroke signs occur 1 month prior. Must not ignore. We're not talking about a stroke of luck. We're talking about that sickening feeling when your brain, in essence, cuts out because of restricted blood flow. Let's be honest, a stroke is one of the illnesses that can significantly impact the quality of your future life. What is a stroke? In simple terms, a stroke occurs when blood flow to the brain is blocked or interrupted. This can happen because of a blood clot or a blocked artery. Also, a sudden bleeding in the brain because of a blood vessel that has burst can also cause a stroke. Blood carries oxygen and nutrients to the brain, and this flow should not be interrupted. Strokes can be life-threatening as a person can literally die from a first stroke and should always be treated as an emergency situation. The faster you seek help, the better your chances are for a good recovery. How does a stroke impact your life? The severity of a stroke depends on the length of the interruption of the blood flow. It's called a mini-stroke when the blood vessel has just been blocked temporarily. The symptoms can disappear once the blood flow is restored. A mini-stroke and a transient ischemic attack, TIA, are one and the same thing. Depending on the side of the brain that had the blockage or the bleeding, the body can become paralyzed on one side. More often than not, a person's speech will be impaired. The stroke victim can also have restricted physical abilities with weakness or paralysis in limbs and experience difficulties gripping and holding on to things. It is often as if the brain is slow to react to any directives given by the body. The impact of a stroke can be temporary if the brain has the ability to heal. Otherwise, a person may have a remnant of the stroke symptoms for the rest of his or her life. What signs should you be on the lookout for? The risk profile for each person to have a potential stroke differs. It is wise to assess your personal risk factors to determine if you fall into the high-risk category. If you had a TIA, don't ignore it, even if the symptoms went away all by themselves. 40% of people who had a mini-stroke will go on to have a full-blown one at some time in the future. Very few people are aware of the fact that one can pick up on the signs that a person is heading for a stroke at least a month in advance. If you become aware of these warning signs, you can avoid the stroke and get medical intervention prior to the onset of the event. Keep a watchful eye out for the following: weakness or numbness on one side of the body, in one leg or arm, or on one side of the face. The face may visibly sag. A sudden excruciating headache with no clear cause. A feeling of confusion where the person feels it's difficult to comprehend things, speak, or listen to conversations. Slurred and unusual speech patterns. Difficulty in seeing clearly with both eyes. Difficulty with walking, feeling dizzy, or the loss of balance and coordination. Experiencing seizures for the first time. Sudden fainting. What risk factors contribute to the popularity of having a stroke? If you suffer from any of the following medical conditions, you're at a higher risk of getting a stroke. High blood pressure. A person suffering from high blood pressure is at a very high risk of a potential stroke. High blood pressure will cause the blood vessels responsible for blood flow to the brain to deteriorate. When the blood has a clot, it can result in a stroke. High cholesterol. It's always good to have your cholesterol levels tested. Cholesterol results in a buildup in the arteries, increasing the risk of strokes and heart disease. Heart disease. The second most significant risk factor for a potential stroke is when a person suffers from a heart condition. A person with a serious heart condition is much more likely to suffer a stroke somewhere in his life. Your lifestyle choices also play an important role in your risk profile. Smoking. People who smoke are at a higher risk for a stroke. Inactivity. A person who does not do regular physical exercise or physical labor is at a much higher risk of strokes. Obesity. Being overweight always puts an additional strain on the body to deal with regular processes and increases the chances of strokes. Drinking. Regular use of alcohol is a contributing factor to a high-risk stroke profile. What can you do to avoid getting a stroke? Fortunately, our hands are not completely tied. Know your family history. If your ancestors have been plagued with strokes and some of them even died because of it, you should have a precautionary approach. Your genetic makeup becomes extremely important when it comes to strokes. Stop smoking immediately. The risk of ischemic stroke is significantly increased by smoking. Smoking causes blood clots, especially in the brain area, and it also contributes to the harming of your blood vessels. Get an exercise routine. The more active you are, the less your body is likely to suffer from high cholesterol, high blood pressure, and diabetes. Conquer obesity. Take control of your weight. If you're overweight, now is the time to implement a balanced and healthy diet that brings your weight under control. Manage your stress levels. It's been proven that stress is a contributing factor when it comes to heart conditions and strokes. By engaging in activities that help you lower and release stress, you're lowering your chances of getting a stroke. Develop a good relationship with your doctor. Prevention is always better than cure. If you have a good relationship with a medical practitioner, he can see the early warning signs of an unhealthy lifestyle and steer you towards a lifestyle that will ensure better longevity. Do a baseline screening of your stats. You should determine your personal risk profile by getting your cholesterol levels, your blood pressure, and your heart health checked out. In conclusion, not any of these warning signs should ever be taken lightly. Even when you don't feel that bad, never ignore the situation. Early treatment is imperative. By acting swiftly, you may preserve your life or that of a person you observe having these signs. Finally, a healthy lifestyle will go a long way to prevent you from getting a stroke, even if you're genetically prone to this type of illness. If this informative video has helped you today, we'd love for you to give us a thumbs up and subscribe to our channel today. Thank you for staying with us until the very end.